Bermuda. Apologies that we're a few minutes late this evening. As you can imagine, that it's been a rather busy day. Thank you for joining us tonight from your homes, where the Minister of Health, the Honorable Kim Wilson, and I will provide an update on the most recent coronavirus test results and other updates from her hardworking ministry. Additionally, the Chief Medical Officer, Dr. Ayo Oyinloye, is also with us to answer any medical or technical questions that come from the media. First, we'll hear from the Minister of Health. Minister?
Good evening. Thank you, Premier. Today, there were 870 test results received by the Ministry of Health since the last update, and 23 were positive for the coronavirus. This gives a test positivity rate of 2.6%. One of the new cases is classified as imported with details as follows. One resident who arrived on JetBlue flight B62879 from Boston on the 3rd of April 2021 and tested positive on their day 8 test. 6 of the new cases are classified as local transmission with known contact as associated with known cases. The additional 16 new cases are classified as under investigation. These cases are among residents with no currently identifiable link to either known cases or history of travel in the past 14 days. There were 14 recoveries and 0 deaths. Bermuda has 1,935 total confirmed positive cases, and their status is as follows. There are 868 active cases, of which 827 are under public health monitoring and 41 are in hospital with 5 in intensive care. A total of 1,051 have recovered, and the total deceased remains at 16. The 7-day average of our real-time reproduction number is above 1, namely 1.11. Before I move to the vaccination numbers, I will share the COVID-19 statistics on hospital admissions for today. There were 43 persons who have the coronavirus in the hospital. There have been 4 new admissions and 5 discharges. 5 people are in ICU and 3 of them are intubated. I will now provide an update on our vaccination status. We have completed the 13th full week of vaccinations. From the 11th of January to the 10th of April 2021, Bermuda has administered a total of 45,761 vaccinations, and that figure rises to 46,935 if you include the vaccinations that were administered on Sunday and Monday. And of course, this is indeed very, very good news. Of the 45,761 vaccinations administered for the period that we are reporting on, which ends on April 10th, 54% are women and 46% are men. Bermuda's goal of herd immunity will be achieved when 70% of the population, which is 64,054, have been immunized. And to date, 40% of the population has been vaccinated with 1 dose, and 31% of the population has been fully immunized, namely they've had 2 doses. To push forward and to get close to our goal more quickly, the ministry will be ramping up the vaccination program at the Bermuda College, as the Bermuda Hospitals Board has done already, with the aim of immunizing 62% of Bermuda's population by Bermuda Day, the 28th of May, 2021. Starting this weekend, the Bermuda College Vaccination Center will be open from 9 a.m. until 3 p.m. on both Saturdays and Sundays, when between 250 to 300 doses of the vaccine will be administered each day. Then from the 19th of April, Monday to Friday, the center will be open from 8 a.m. until midnight, with an additional 250 people a day to be vaccinated. This is a great step forward for the country's vaccination program, with 1,550 extra doses being administered weekly. The ministry team is ready to ramp up our vaccination program, but we need help. We are appealing to all of the doctors in Bermuda to give us some of your time. If every doctor in Bermuda takes 1 or 2 shifts on a weekday evening or during the day on a Saturday or Sunday, we will succeed, and Bermuda will succeed. As the Minister of Health, I am calling on the medical fraternity to make this commitment to our community. If you can help, please contact Dr. Brett Lefowitz at BLEFKOWITZ@gov.bm. That's BLEFKOWITZ@gov.bm. The Bermuda Hospitals Board already has increased its vaccination output this past weekend, extending its hours on Saturday and expanding to Sundays as well. The BHB will focus on delivering an additional 750 vaccinations each week. It is anticipated that the increased vaccination capacity will be very close to herd immunity by the end of May instead of mid-June. The simple message right now is this: if you haven't already, get vaccinated. There's no need to wait. There's no need to delay. Go online and put your name down to register. The process takes no more than 2 minutes. If you do not have access to the online form, you can phone 444-2498 and register. We all have a role to play to keep our country safe. I'm excited about the possibility of Bermuda moving more quickly, achieving herd immunity. Getting vaccinated is something we can do for ourselves, our families, and our community. Just imagine celebrating Bermuda Day with a small group of immunized family and friends. I want to extend a sincere thank you to the many physicians, EMTs, pharmacists, nurses, dentists, and other allied professionals who have already taken it upon themselves to be a part of the vaccinating process at the vaccination center so far. We could not do it without them. Thanks also to the Bermuda College for continuing to work with the Ministry of Health so that we can implement these new hours, and to the Royal Bermuda Regiment for its continued and welcome support. I must also publicly again recognize the men and women of the Ministry of Health who are part of this vaccination program. They have all worked tirelessly and long hours to ensure that we can offer the vaccine to all of those in our community who wish to be immunized. I will now talk about the changes to the ministry's testing program. Since April 2020, the Ministry of Health has primarily used the nasopharyngeal test. The test sample is collected from both nostrils by a trained swabber. The new testing protocol will allow 3 additional testing methods to be used. The oropharyngeal test, which is the test sample, is collected from the back of the throat by a trained swabber. This test is for those directed to get a test by a healthcare professional, and this test is used on children and adults with a history of nasal problems. The nasal mid-turbinate test, and the sample is collected from both nostrils. It is self-administered and observed by a trained swabber. This test is for travelers and people who are concerned that they may have been exposed to a confirmed case. And then the saliva test. The sample is self-administered and observed by a trained administrator. And this test is for travelers and people who are concerned that they may have been exposed to a confirmed case. The additional testing protocols will enable the ministry to use its staff more efficiently and thereby increase our capacity. The testing will take place at the following locations. Star of India and Pennell's Wharf are reserved for those who are concerned that they may be positive for the coronavirus and for those outbound travelers. Bull's Head is for those who have been identified as a close contact of someone who has tested positive for the coronavirus and for people who have COVID-19 symptoms. And the Pirot Post Office is also for persons who have been identified as a close contact of someone who has tested positive for the coronavirus and people who have COVID-19 symptoms. Anyone getting tested is reminded that they should not eat, chew gum, or smoke 30 minutes before taking the test. Details of the new process are on our government website at coronavirus.gov.bm. As I close, I would like to remind you, each of us have a role to play in stopping the spread of coronavirus. Follow public health guidelines, wear your mask, practice good hand hygiene, maintain physical distancing, and download the WeHealth app, Bermuda app. And if you haven't already done so, register to get vaccination, because vaccination is the key to our freedom. Thank you.
Thank you, Minister of Health, and thank you and your teams for the excellent work which you continue to do as we deal with this current outbreak. Last night, the Minister of National Security, the Honorable Renee Ming, and I had a Facebook Live Q&A where we provided clarity on the current regulations within the stay-at-home order. Persons who did not see that last night can view it on the government's Facebook page and the CITV YouTube page. As we covered them extensively last night, I will not reiterate all the regulations at this present time, though we'll be happy to take questions on them from the media. However, I will reiterate a few key points regarding businesses. During the 7-day stay-at-home order, only permitted businesses are allowed to operate between the hours of 7 a.m. and 7 p.m. Those permitted businesses are grocery stores, pharmacies, banks, which are offering limited services, gas stations, offices of registered health professionals, such as clinics, the hospital, or other health facilities that include veterinary services. All other businesses must remain closed. We are aware that there were businesses that opened this morning that are not on this list and have since been closed. If you are not one of the permitted businesses listed in the regulations, you must remain closed while the stay-at-home order is in effect. Traveling to and from a permitted business is allowed, including travel to the grocery store on your designated shopping day, the airport and/or testing or vaccination centers. For those who need to apply for stay-at-home movement exemption, please go to forms.gov.bm. And on there, you will see a stay-at-home movement exemption form that you can fill out and complete. I've also been informed that this is going to be added to the top red banner at gov.bm later this evening, so you can go to gov.bm. This website also lists the exemptions that are already set out in law and will state that you do not need to fill out an exemption if your movement falls within those particular categories. So it is certainly a good resource if you want to understand what is and is not allowed. For those who cannot work due to mandatory closures or they are in quarantine, the uba.gov.bm website, that is the website to apply for the unemployment benefit, will be available for submissions from applications from tomorrow, Wednesday, April 14th. The website was taken down yesterday to ensure that it could be updated to reflect the latest changes in regulations and to make sure that there were not erroneous submissions of information to that website. But the website will be up. The Minister of Finance has confirmed, and persons can go there to get their information. With effect also from tomorrow morning, businesses can go online to bedc.bm, to the website of the Bermuda Economic Development Corporation, to apply for the updated and expanded COVID-19 emergency grants, as well as updated and expanded COVID-19 combined loans and grants under the Business Continuity and Sustainability Funding Program. Emergency grants will be used to cover immediate costs associated with recurring expenses, including rent, utilities, social insurance, and health insurance premiums for employees. Emergency grant funding will be available in the maximum amounts ranging from $5,000 to $7,000 per business. Businesses impacted by public health notice closures and restrictions back in December 2020 and January 2021 who received an emergency grant already can reapply for another emergency grant. However, the maximum amounts available to these businesses will be 80% of the first maximum grant amount. Again, for businesses who are impacted, there are a combination of assistance that is available at the Bermuda Economic Development Corporation. And as of tomorrow, you can go onto the website bedc.bm to apply. As we end the first day of our 7-day stay-at-home order, I'd like to remind the country why we have taken this step. Due to the swift increase in cases over the last few weeks, our healthcare workers have seen a significant increase in our workload and are struggling to keep up. If we did not act, this workload would only continue to increase, and our entire healthcare system would be under immense strain. As I mentioned in previous press conferences, our healthcare system not only includes the hospital, but also includes our vaccination program and workers, testing centers, and labs. All workers, such as contact tracers and other frontline teams who are working tirelessly for the people of Bermuda. These next 7 days will allow the following crucial steps to take place. First, stopping the major causes of spread in the community, mixing of households and persons mixing inside of work environments while not following the precautions which have been set out. Contact tracers will be able to catch up on their current caseloads. We will be able to ramp up our testing regime, which will include enhanced community testing with the addition of additional modes of testing as the Minister of Health has outlined. We will also be able to expand our vaccination program, which will include new sites and increased doses administered each week, as the minister announced earlier. By increasing the amount of vaccine doses administered each week, we will take significant strides towards herd immunity, with our ultimate goal being to have the majority of the country vaccinated by the end of May. This strategy calls for continued support and cooperation from all Bermudians so that we can ensure to reach this goal. Later this week, we will hold another press conference to outline the next steps in terms of regulations, including changes for the next steps in regulations. When making the decisions, the government will continue to be led by the data. While the stay-at-home order is expected to end after 7 days, there will still be strict regulations in place to help us stop the spread of this virus and enable us to open business safely and allow our vaccination program to increase its pace over the coming weeks, with a goal to reach near herd immunity by the end of May. I want to thank all persons in Bermuda who are doing their part. Firstly, by calling 211 to report regulation breaches to the Bermuda Police Service. I encourage all persons to continue to call and inform the police if you're aware of any breaches to the regulations. Though I sincerely hope that as a country, we will all come together, follow all regulations, and do what is necessary to end this outbreak. In closing, we recognize that there are many who are struggling emotionally and require additional support. For those persons, the Emotional Wellbeing Hotline is open Mondays, Wednesdays, and Fridays, and Saturday from 5 p.m. to 9 p.m. If you or anyone you know requires extra emotional support, please call 543-1111. Please do not suffer in silence. Call the hotline and get the support that you need. Useful information on how to cope with stress, as well as a list of psychologists you can book a private appointment with, can also be found on the Bermuda Psychology Association website, which is bermudapsychology.com. I also recognize that staying at home does cause challenges for some who may not be in the most stable position at their home. If you are in an abusive situation and you need help, the Center Against Abuse offers a 24-hour helpline, 297-8278, where their counselors conduct sessions over the phone. If you have an emergency, dial 911. You do not need to go online to apply for permission to leave your home if you are suffering from abuse. It is an emergency, and please, there are services available to support you if you are in that situation. Before we take questions from the media this evening, I'd like to thank the Minister of Health and Dr. Ayo for joining me tonight and for the incredible work that they and their teams are doing, and all the frontline workers that continue to do that work day in and day out. As I indicated, there will be another press conference later this week where we'll lay out further details of what the next steps will be after we continue to analyze the data and make sure that we are able to continue this process safely while reducing the stress on our healthcare system. Thank you for your attention, and I'm welcome to answer any questions that you may have.
Premier, we'll have the first question from the World Gazette. World Gazette, you're live. Please ask your question.
Good evening. Hi, folks. Just checking first of all to make sure you can hear me.
We can hear you. Go ahead.
Brilliant stuff. Thanks. Yeah, it's Jonathan Bell from the Gazette, and thanks for having us. That was some fantastic news about the increase in our vaccination ability. I'm looking at the math on getting to herd immunity by the end of May. We're looking at that. We're going to need to get about 4,500 people a week to get their first shot. I know we're increasing access to it, but if the numbers don't show up for it, I guess can you walk us through a bit more about how we aim to really ramp that up, vaccinated in those numbers that you're hoping for?
Thanks, Jonathan. I think what you said is critically important, because in order for us to get to the objective that we have, which is to be close to herd immunity by the Bermuda Day holiday, we need to ramp up our vaccination, which is why we insist and to volunteer their time for 2 shifts between now and the end of May, so that we can add another shift, so to speak, at the Bermuda College from 8 p.m. until midnight. The other aspect that will allow us to get there is to encourage people, continue our encouragement of people to register. And we need to remind members of the public that getting vaccinated is not just to benefit you, it's to benefit the other members of our community. This is an altruistic event and an exercise that will benefit all of us if we do our part. And when the Premier speaks to us doing our part, that's part of it, is that we need to all recognize the importance of immunization. And that's going to be the best and only way we can get through this particular pandemic. The virus will reach a brick wall, so to speak, when we have a community that has reached herd immunity. So part of the messaging has to continue surrounding it around the importance of persons to register. It takes literally 2 minutes to register. We're ramping up our vaccination times and so forth, so that we will be able to immunize all persons that wish to get immunized. And that's our critical, important message, because we cannot get out of this without immunization. Thanks, Jonathan.
Thanks. I do get a lot of messages on the likes of WhatsApp. It seems that the skepticism is remaining remarkably resilient out there, although that said, that's WhatsApp. In terms of motivating people, I guess that's, if they don't show up for it, or what are we looking at really driving this message home that people need to do this?
Because if they don't, then we're going to find ourselves in a perpetual case in where we are now, where we will have more and more persons in hospital that are suffering from the coronavirus, and more deaths. I think that has to be the resounding message, that if we're doing this for our community, we are all in this together, we are all sailing in the same boat, and the way that we can continue to navigate through this thing called coronavirus and COVID is for us to be immunized. And I think that has to be the messaging, and we have to just continue to enforce that with members of the community. Yes, there is some skepticism. I suspect it's probably the vocal minority. If you look at the last omnibus survey, the tide is changing, and that there's more persons that are now less on the fence, but have agreed and have indicated that they will actually be immunized. And in fact, the recent omnibus survey only indicated 1 out of 10 persons said that they would not be immunized. So it's changed drastically since December.
Thanks.
The positivity with respect to acceptance of the vaccination, as stated in the omnibus survey.
Thanks. Mr. Premier, I wanted to ask, what's been the situation with contact tracing and quarantining as far as you're concerned with other ministers and members of the civil service, people that you've been in meetings with? Have others had to quarantine, or have others tested positive? Can you tell us a bit about that?
I certainly wouldn't tell anyone if anyone says positive. I know that my family is not. But what I can say is that we went remote a very long time ago. So we've been work remotely, and the government's been following the advice of which we have given ourselves. So it's been significant amounts of remote work that's been taking place. So the contact tracing exercise was relatively easy, to be honest, because there are not a lot of contacts of which we're had.
Thank you, sir. Glad to hear it. Now, apologies if I'm asking something that you answered. My feed cut out a couple of times. As far as the BHB vaccination center, I think originally they pledged that for 10 weeks. This is going back to the whole herd immunity by the end of May. Did you say, is that going to be extended if that 10 weeks is used up? Is that time going to be extended, or we'll be looking at a new vaccination center when the time is up on that 10 weeks at BHB?
Actually, BHB are wonderful partners. I have to commend them for their partnership with us in trying to do their part to ensure that the community has access to vaccination. They have added weekend vaccinations, Sunday vaccinations, as well as extended hours, and they are equal partners in this. And as equal partners, they will continue the immunization rollout until we have reached the herd immunity position, which again, we anticipate to be around the Bermuda Day holiday. So they're on board, and they will do whatever is needed and have committed to that. And their actions are tantamount to the commitment, because they've added on more vaccinators as well as more days. So they're running it 7 days a week. And we have to applaud them and commend them for their efforts.
Thanks for that.
Thank you, Jonathan. We're allowing the media full questions today, so thank you very much for your time.
Did I not have one more there?
That was only 3, Adirondack.
That was 3? Oh, forgive me.
I'll make it quick. This is just to do with the sailing event. So I guess it'll be yourself, Mr. Premier. Given the revelation that SailGP could get canceled if the teams aren't able to practice in these new boats ahead of the April 23rd to 25 weekend, I guess, have there been any concessions made there? Or are you able to tell us anything about how we're navigating that part?
I would say that Bermuda's ability to host events generally is certainly an important part of our tourism recovery. And it doesn't actually matter if it's sailing, golf, carnival, or cup match. We have to prepare ourselves for hosting events safely in light of the change that this global pandemic has brought to the entire world. And so it just so happens that right now it's sailing. What I would say is that the same precautions and rules apply for any event that we hope to host in the near term. And so the BTA is liaising with the Ministry of Health to determine how any public health risk can be mitigated to support this event. Let me be absolutely clear. We know the economic importance of the event and events generally to the economy, and the need to balance that with our existing public health status. So there have not been any determinations made as of yet. We recognize the risks that are there, and we're trying to figure out what can be done.
Thank you, sir.
Thank you very much. And we will now bring in TNN. TNN, you're live. Please go and ask your question.
Good evening. Good evening. Thank you for, thank you. Premier, questions are being asked. Have there been any updates from the finance minister on the second round of possible pension withdrawals?
Thank you for asking the question. That was a matter that we discussed in our cabinet meeting earlier today. And it's something that the Minister of Finance is working on, and we'll be liaising with the Pension Commission to seek advice, and we will be able to make an announcement to the public. But I think the most important thing to note that for persons who do need and require support, whether they be individuals or businesses, the government is making that support available. And both of those applications will be ready to go tomorrow. For individuals, they can go to uba.gov.bm, or for businesses, they can go to bedc.bm.
Thank you. Another question for healthcare workers, that not everyone has a washer and dryer, and other members of the public. When would consideration for laundromats in a timely fashion to be allowed open rather sooner than later?
It is the expectation that those things will be open following the expiration of the stay-at-home order, but we'll be giving further details on those matters when we get to the press conference that we will hold later this week. We recognize the challenge that is there, certainly. We recognize it and we understand it. What we are trying to do is prevent the mixing of households. There is exemptions inside. So when you're speaking about healthcare workers, there are exemptions inside of the rules for laundry services who are serving facilities that are open. So healthcare workers would fit underneath that, and they should speak to their employer to see if they can take advantage of that.
I just want you to note, this is just a statement I want you to note for those that are viewing. I have about 60 questions and we're only allowed 4, so bear with me and please apologize if I don't get to your question. Premier, this next question is for you, and thank you very much at the last press conference where you volunteered information that you have contracted the virus. My question is, many at this time would be, the question many have asked at this time, would this be a time where the Deputy Premier would have more of a role in the conference and administration, et cetera, as would be the case in other jurisdictions where you can possibly get some rest?
Trevor, I promise you, I would certainly love some rest, but we are a team that works together. So the Deputy Premier has specific responsibilities that he's carrying out as the Minister of Health, as all other cabinet ministers. As I said, the contracted coronavirus infection, I feel perfectly fine, absolutely no symptoms, quite shocking. It's a very low CP value, but I'm okay and I'm carrying on. So, you know, we have these diagnoses, we get them, but it proves the use and utility of the vaccination. So I'm at very low risk for developing disease. I know there was a lot of hay that was made about what I said and how I said it. What I was trying to make sure I relayed to the public, instead of having a lot of people worried about me, is that I am fine. I feel completely fine, not a single symptom. And when I tell you the diagnosis, because how often I test, it was just a complete and absolute shock and surprise. And we still can't know. I mean, I tested negative on Friday, and literally there has been no interaction. I tested 5 times in the last 3 weeks. So it's quite surprising and shocking to me, but I feel fine. But I thank you and your listening audience for concern. I will say this, though, that me and the Minister of Health are extraordinarily tired. So we're going to try to get a little bit of rest tonight for sure. But rest assured, the team is pulling the weight. The Deputy Premier has been a great assist, as he always is.
Did you say this weekend? This weekend, the weekend we were going to have the whole weekend? Did I hear that?
My final question. There seems to be a lot of abuse from employers and having staff that have been quarantined because of school issues and other issues, close contact. Staff are being charged for either vacation or sick. Premier, how do you handle such a situation? What's the law with this abuse? I've had many questions being thrown at me to mention this to you. How does employees handle this situation?
Thank you, Trevor, for that question. It's a very important question that's asked on behalf of your listeners, and you do a great job of making sure that you ask questions that need answers to. So I appreciate you bringing that forward. On this particular issue, Trevor, the Ministry of Labor is the best place to go with those particular complaints. It was a discussion that we did have in our cabinet meeting earlier, and there will be notice that is going to put on the best place to go for complaints. There was a message earlier where an individual was being forced to go into work, and it is illegal for an employer to force someone to go into work. So that employer is putting themselves at a position of liability. So it is certainly a challenge. So I would say that stay tuned to get that information. What I would say is the first place will be the Ministry of Labor, but we're going to put out a very clear and concise press release on that so that you can share that with your readers, that all members of the media can share that with their readers. But as a reminder, your employer cannot compel you to come into the office unless you're one of those permitted businesses, and remote working is mandatory. It is not a question of, remote working is mandatory. Now, if you're a permitted business, you are not required to work remotely. But if you are not a permitted business, remote working is mandatory. Now, those are for the people that are fulfilling the matters which are. If you're in an administrative role, which your role can be done at home, your employer cannot force you to come into work. And I want that to be very clear. The Ministry of Labor, the government, is going to make sure that employers understand. And for persons who are being abused by their employers, they can be covered under Whistleblower Protection Act. And we're going to make sure that it's a statement that comes out from labor speaking to those matters specifically. So Trevor, thank you very much for that question.
Can we get a hotline for that number?
We do not have a hotline, but as I said, we are going to make sure that that is made available for persons so they know exactly what number to contact, Trevor. Thank you very much for the questions.
Thank you.
Thank you very much. We'll now go to Bermuda Broadcasting with Don Burgess.
Good evening and thank you. CMO, the hospital seems to be filling up with over 40 COVID positive persons, including 5 in the ICU and 3 intubated. As mentioned by the health minister, can you say what percentage of the total hospital beds in the ICU are currently taken up by COVID patients? And if there are staff shortages at the hospital, what can you do to make things work with less staff, i.e. what are the next services that will end up being cut?
Hi, that question should really go to the hospital, not to me, because I don't work in the hospital. So I won't be able to answer the question about the proportion of beds that are taken up by COVID patients. That needs to go to the hospital. Your second question is about staffing and staffing issues.
Yes,
Correct?
correct.
Right. Okay. So this is a continuous discussion we have with the hospital and hospital management on how we can help and how we can assist. And a significant, particularly among clinical staff, a significant proportion of staff are already fully vaccinated, and following exposure, many of them do not show any signs or any symptoms. So we've been working with them on the safest way to bring people who may be exposed but are completely asymptomatic back to work. And we've only recently put together a workplace isolation policy that allows us to do exactly that. And that increases the pool of staff available to the hospital to work safely.
Okay, thank you. Again, dealing with the hospital, many more and more first world countries are starting to make it mandatory for healthcare workers and long-term care workers to be vaccinated when working around patients. But we've heard from local doctors and healthcare providers in Bermuda that one of the main reasons the percentage of unvaccinated healthcare workers, and particularly staff at the hospital, remains high is due to the union there being so strong and not allowing this discussion to take place. Either your comments or the health minister comments on that.
I think, John, thank you for the question, but I think those are more suited for the hospital. Those are the issues concerning administration as well as how they operate their facility. They were best suited to answer those questions, Don. And I would invite you to speak to their personnel there, their PR persons, to answer those questions directly.
Okay, thank you very much. Premier, you have said that travelers coming to Bermuda this summer will need to show proof of being fully vaccinated. You've also said that cruise ships will be able to home port from Bermuda if the cruise staff and guests are fully vaccinated. And the transport minister says a deal has been done for Bermudian entertainers to perform on board. With these strict vaccine rules in place for the tourism industry, will other Bermudian industries and employers and local businesses be able to copy this vaccination policy and mandate that their own employees show proof of vaccination so that the businesses can keep their workplaces and employees safe from COVID? And if not, why not? And why, if not, why the double standard?
Well, I wouldn't go so far as to say that it's a double standard because we control the people who come into our borders. But as we have stated very clearly that we are not going to be implementing mandatory vaccinations here on island. So the legal issues of which you raise are complex. What I would state is that one of the conditions for home porting, recognizing the challenges that we could have in an incident if there was a cruise ship here that wasn't required to have a environment where persons did have all of their vaccinations and had immunity from COVID. What I would say is that that posed a risk to us. So we decided that for these things to happen, all crew have to be vaccinated and all persons who are arriving into the country vaccinated. And it would work because remember, we've stated that by the time we get to June, which is after the time when the cruises start, that there is going to be the imposition of a mandatory period of quarantine for non-immunized passengers. So that wouldn't have worked anyhow. People would have to come here and stay days in advance before they were able to get onto a boat or a vessel. I would say, however, that certainly if the cruise ship is going to have local entertainers, all crew on board will need to be immunized, and I'm sure that will apply to those persons as well.
Okay, thank you. My last question tonight, Health Minister, you stated that we're trying to reach herd immunity of 70% by the May 24th holiday. And at current rate, we're at, sorry to pull some maths on you, but we're at 40% with one dose. And in order to reach 70% with 2 doses by May 24th, that would mean each of the next 3 weeks would have to have 10% of the population vaccinated, so that by May 3rd, everyone, there's 70% at one dose. So by May 24th, there's 70%. Do you feel like that's a bit ambitious, trying to vaccinate 10% of the population each of the next 3 weeks?
Absolutely, it's a very ambitious target, but I'm confident that we will be able to reach that target with the men and women that are working at the immunization centers at both BHB as well as the Bermuda College, with the additional physicians that I'm anticipating will join the call to volunteer for 2 shifts between now and that particular time, the Bermuda Day holiday. I'm absolutely certain that we'll be able to reach that target. And I thank you in advance, as well as other members of the media, to ensure that you assist us in getting the message out with respect to the importance of immunization and vaccinations, and that will be the only thing that will help us to get through this particular challenging COVID phenomenon. But I'm certain that we will reach that. I believe that we certainly have the infrastructure in place to do so. We just need to make sure that everybody takes advantage of a 2-minute call to register to be immunized.
All right, thank you for your time tonight. See you guys Thursday.
Thank you very much, Don.
Thank you very much. We now have Earl Basden from Island Stats. Earl, you're live. Ask your question, please.
Good evening, everyone. To the Premier, what happens once government reaches herd immunity of 70%? Do we go back to having full sports with fans kind of the next day? What happens?
I'm certainly not certain that we can go to having full the next day. I think we have to look at the picture, and it's a great question, Earl, and you know how much I miss my sports and how much I miss those things. And from the perspective of getting to herd immunity and what does it look like, the fact is that we made a conscious decision last year to make sure that we were able to support our tourism industry. We were very successful last year with one of the best testing regimes in the world. It worked very well. The thing is that this virus changes. And so we look at what took place in November, where there was an outbreak that we were able to roll back to phased restrictions and get that outbreak out very quickly. We look at what happened this time around, where we implemented the phased restrictions even earlier than we did in the outbreak the last time, and that was not sufficient, and why we were dealing with a new variant. The fact is that these variants are continuing, you know, whether it's B.1.1.7, or whether it's P.1, or whether it's B.1.5.1, or whether it's something in California, New York, or somewhere else, the variants are continuing. And so the view and the change for the government of Bermuda is, now that vaccines are fully and readily available in all of our major gateway cities, that we are going to change our approach. And that means that we need to tamp down and eliminate the virus here on the island while increasing the protection of the border. The protection of the border will be increased, and for persons who are entering the country who are non-immunized, will have a significant period of mandatory quarantine. When we have a place where we are relatively secure and we have herd immunity and there are no cases in the island and relatively few cases, and we can catch those cases, then we will certainly be able to relax restrictions. What I don't want people to think is that by the time the day we reach 70%, masks are all gone, limits are all gone, the same day, all the rest. We need to work through the time to make sure that the virus is out of the way, that the protections are working, and the rollbacks will be able to happen. But to answer your question, I fully expect to be in St. George's so that Somerset can take the cutback this year for Cutmatch. And the only way we get there is if people register for the vaccine so that we can be ready to hit that target that we've laid out. We are going to, the Minister of Health is working very hard. We're trying to do additional things. Minister of Health has said that I can't talk about the press conferences until they're fully confirmed. So there's more announcements to come when we're talking about how we're going to get these vaccines out. But the most critical point is that we see an end to this. It is going to be an adjustment, Last year, it was not this way, but now we know that things have changed. So a year later, there is a different situation, and we can afford to make sure that our border is closed to non-immunized travelers. For people who want to come in, they will have to have that period of mandatory quarantine. We will still test people to ensure that even persons who are immunized, who can contract the coronavirus infection, as you were looking at someone who has done so, to make sure they're not carrying a variant, to make sure all the rest. So we're still going to have those protections. But we believe that with protections at the border, with significant amounts of person immune here, with the restrictions of which we're going to have in place as we get up to that place of herd immunity, that we'll be able to have a significant reduction of cases here, and that will see us begin to relax restrictions and hopefully not, have a all of us have to be in the warm St. George's air, even though this nice breeze is coming off for a cup match with masks on. But it remains to be seen. And so I don't want to make any promises, but the objective is to get there. The objective is so that, we can have the things in which we want to have. We can do those things. So the fact is that everyone wants to talk about, whether it's SailGP or this, all the rest. We want to have our local sports too. We want to get back there. And that's what's important. And so that's what we're working towards. And that's why it's so critical that we all be a part of this effort. As the Minister of Health has said, the vaccines are not just about you, it's about the community. And it's about protecting those persons who are unable to get a vaccine for whatever reason. There are people who cannot get vaccines due to their medical history. And so for us, it's important that those of us who can go ahead and do so that we can create that protective bubble here in Bermuda.
A press release from the Bermuda Police Service indicating that people can't ride the pedal bikes for exercise. Now we have people that train and cycle, but we have a lot of people that exercise, which could also be used as a stress relief. Can anyone give the public a reason behind this action not being allowed if you're out riding by yourself, just for exercise or stress release?
Earl, I can't speak to what came out from the Bermuda Police Services. I haven't seen that, but what I can say is that we're trying our best to keep people inside as much as possible or on their properties to make sure they're not mixing. I do not believe that is actually different than what took place last year during the period of time that we had ourselves in our homes. And trust me, I recognize the criticism when we're talking about beaches and parks and all the rest. I recognize it, but what we're trying to do is to minimize the excuses for people to go. The intention for this stay-at-home order that we have in place is to expire after 7 days. We need to figure out exactly what that next phase will look like, what the restrictions will look like. We understand and recognize. I know it's not something I like. I do not wake up in the morning saying I want to tell people they can't go on the beach. I want to tell people they can't ride their bike, or to tell people they can't do this and tell people they can't do that. It is a challenge, but the intention is for these 7 days to ask everyone just to pause their best, and then we will get to a place where we can begin to relax the restrictions. We knock on wood. You hear me knocking hard. We've got positivity rates there. We were there a few days ago where some of the rates went down. They shot back up. It's a worry. So we are hoping that the restrictions that we put into effect over 2 weeks ago are beginning to show up inside of these testing. We're hoping that the work of the contact tracers, and Dr. Io can speak to that, is less. But the view is we're just trying to hold everyone home. It's not to say, oh, I don't want you to exercise. I'm not saying I don't want you to do this. No, that's not what this is about.
Okay. Did I hear you answer a question that all questions regarding the SailGP are to be directed at the BTA? And if so, why? Why aren't the country? We're in a crisis. Why shouldn't we be?
What question do you have on SailGP? I answered one earlier. What question do you have? I would say I have been in gathered all day, so I don't know what the latest is. So, but ask away.
Well, I mean, clearly, there was a question I had at the 2 weeks ago regarding if anyone from the organization, within the organization, had tested positive that wasn't answered or had contracted.
And here's the thing I can tell you, Earl, I do not have an answer to that question. And I am uncertain that it would actually be allowed for someone to release that information. I volunteered my thing, but I don't, and that's just something from a perspective we don't, but I don't know if that is the case. I'm uncertain if the CMO may know, and if the CMO may say that he can answer the question. I actually do not know.
Okay, but did you answer a question saying that direct your questions to the BTA?
Did I answer? I think that there's a request for media questions to go there, but if you have a question, Earl, you
Okay,
have
no,
one
no,
more, ask away.
I was just
More,
making
ask away.
sure. No, I was just making sure because if now we're directed to the BTA, I just want to make sure that we were asking, and I think the public is sitting here waiting to hear whether or not this organization will be given the approval to even start training again.
Well, here's the
Because
one.
I know it's important.
I'll state the thing that I stated earlier, Earl, and I'll state it again, is that, our ability to host events generally is an important part of our tourism recovery. And so whether it's cup match, sailing, or golf, or even carnival, we have to prepare for hosting events safely in light of the change that, that COVID has brought to this world. So it just so happens that right now it's sailing, and the same precautions and rules apply for any event we hope to host in the near term. And so the BTA is liaising with the Ministry of Health to determine how any public health risk may be able to be mitigated to support this event. We know the economic importance of this event and events generally to the economy, and the need to balance that with our existing public health status. And so we're still working through those things. The answer that I gave on Sunday was that SailGP was not part of a consideration of what we were doing when we were discussing these restrictions. They're not. So we now have to deal with the things which come after the decisions that we've made in the interest of public health. And that's where we're working.
My final question would be, we have elite athletes who are attempting to qualify for things such as the Olympics and other international events. Has any consideration been given for them to be allowed some access to training during this period? As you've indicated, it's very difficult for elite athletes to be out of training for any period of time.
Earl, that's a great question. It's not something that we've ever considered. I'm sure someone may want to make a request to the Minister of National Security. Something may be considered like that. It's a great question. I'm happy for you to write in. It's not something we've considered, to be completely honest, but I understand giving it as an Olympic year, there may be one or two cases and people who are going to represent the country. It's something that may be able to be considered, but the main message is, 7 days, but elite athlete, you're right, getting ready to qualify for the Olympics or something like that may be a challenge. So the last thing we want to do is have one less Bermudian representing our country in Japan.
One was turned down today, but I'm done. Thank you.
Look at you, Earl. You got all the tricks. Seriously, Earl, have that person shoot me a message. It is a consideration, but I can accept that what we're trying to do is to hold tight.
Okay.
Thank you very much. We'll now go to Media Maya. Media Maya, you're live. Ask your question.
Good evening, everyone. Maya Palacio here for Media Maya. My first question actually is a community question. So somebody wants to know, if a resident received their first dose of the Pfizer vaccine in America, will they be able to receive the second dose if they're on the island during the time their second dose shot needs to be administered? And who can they contact to schedule?
Maya, sorry. The policy that we've implemented for the vaccine strategy is for residents of Bermuda only.
Yes, this person is a resident of Bermuda, but they're away at the time, and then now they're home.
I'm sorry, I misunderstood that. I'll yield to the CMO because I don't know if there's an issue about confirmation of the dosage and I'll leave it to the CMO. I'm sorry, I misunderstood you. I didn't realize that they were a resident, Bermuda resident.
Okay. Well, thank you, Minister. If they are Bermuda residents, that's the first check, and we need to have confirmation of the dose that they had and the time that they had the last dose. Once all of that is confirmed and we can verify that, then there's no issues in adding them to our vaccination program. But the crucial thing is that we need to protect the integrity of our vaccination program, and we need to make sure that all the information we get is correct and is accurate. That's what's going to protect the integrity of our vaccination program.
Thank you very much, Dr. Ayo, and I've just been informed in messages that Ms. Palacio, the question which you've asked, that situation has happened with a Bermuda resident who got a dose of Pfizer away and did come here and get their second dose. So the answer to the question is that the wonderful officials of the team at the vaccination center are able to assist with that. So
Thank you very much. My second question about the unemployment benefit. There are unfortunately many people who do not, pay into the tax roll because let's say they work job to job just to make it by on the island. And without payroll tax, you cannot apply for the unemployment benefit. So some of these people have been facing financial struggles since February 2020. Many are facing charges of imprisonment because they cannot pay for court bill orders or even child support. So what support is there for these people?
The support that's there and so outside of the unemployment benefits, certainly that's for persons who are working. But for individuals whom you mentioned, there is the Office of Financial Assistance, and there's two things that have been rolled out. There is an additional supplementary unemployment benefit, which is separate from the short-term unemployment benefit for those persons who need additional support. And that was introduced, I want to say, last year, late last year, and is administered. So that support is there for them, and they can contact the Department of Financial Assistance.
Where can they contact the financial assistance? Like, is there an email for that?
I wouldn't have that, but if you look at the press releases which came out recently from the government where they said how to access the services, if you reach out to Director Wilson, I'm sure you can get that information.
Okay, thank you very much. My next question, Minister Wilson, you recently just said in the press statement tonight that the vaccine is the key to our freedom. So my question is, when we achieve this herd immunity, do we go back to pre-COVID days, or what changes will happen once that goal is reached?
I can barely hear you, but I believe your question was similar to what Ivan Stats asked about what happens when we reach herd immunity, Maya?
Yes, it was.
Okay. When we reach herd immunity, obviously that will be a wonderful day. However, as the Premier indicated, and I'm sure the CMO can confirm, insofar as whether or not we can then immediately remove our mask and stop participating in hand hygiene and the like, that's somewhat questionable. I think it's probably a good habit that we've all adopted now, is to make sure that we wash our hands regularly and so forth. But we kind of have to wait and see. I mean, reaching herd immunity is brilliant because we'll be able to stop the virus spread. But insofar as whether the next day we'll be able to remove our mask, I think we have to just kind of play a wait and see measure. But it is likely that obviously there will be quite a less amount of the restrictions that we have. But that's just a matter of, and I'll yield to the CMO, but that is a matter that we have to kind of play a wait and see for. But insofar as whether or not the next day we reach herd immunity on a Monday and the Tuesday, we can rip off the mask, I suspect that's not necessarily the case. CMO?
Yeah, thank you, Minister. So the best analogy I've had is that of the Swiss cheese. So each of the measures that we put in place is a bit like Swiss cheese with the holes. There will be a couple of people who will still have that may still be vulnerable with each of the measures that we put. Our best tool, as the Minister and the Premier said, is the vaccination. So that needs to be coupled with all the other things that we've talked about. So we may still need to have our mask on for a while. We still need to have the good habit of washing hands and sanitizing hands and avoiding major crowds. And the reason for that is because we would, there are still a couple of variants that can come into Ireland and cause problems. So we need to be quite careful about that. But with regards to the wild type virus and the bog standard virus, if we get enough people vaccinated, then it's unlikely that the disease can spread on Ireland, and it will come against dead-end infections, as I've always talked about. It means when we get that on Ireland, the people who are vaccinated are much less likely to be able to spread this virus. So we can all enjoy a level of restrictions, a level of relaxation of the restrictions, I should say, that is not present at the moment. But what exactly is going to happen would depend on the situation we find ourselves with variants at that point in time.
Okay, thank you very much. And my final question was about the sale GP, but because I believe Island Stats. I couldn't hear, but I think they asked this question. I'll just ask a different one. What does the government consider people who have been fully, who have, sorry, not that question. I apologize. My question is, do people who have been, have you had record of people who have contacted COVID twice? Sorry, that's the question.
Yes, I can answer that. So we have know of at least 3 cases of people who had an infection in before Christmas, so the November-December outbreak that we have. The predominant strain that was circulating at the time was wild type virus. And we know of at least 3 cases of people who have subsequently become positive with the B117 strain. So yes, it is possible to get reinfected with COVID virus, especially if it's a different strain that is circulating. And that's why it's important not to rely on the so-called natural immunity to protect you, because variants change. Fortunately for us, the vaccines that we have on island is effective against quite a few of the variants that are around, and the protection is such that we can rely on for at least the circulating variants on island at the moment. So it's not being infected does not protect you 100%.
And so you would not consider persons who have recovered from COVID as numbers into the herd immunity?
Could you say that again? I can barely hear you.
Sorry.
Speak
I
up,
was
Maya.
asking for those persons who have recovered from COVID but have not gotten the vaccine, you do not consider them as persons included in the herd immunity?
No, we don't. It's for the reasons I've just explained. The virus circulating at the moment now, any immunity that you may have to the wild virus does not protect you against the virus that's circulating at the moment. No, so we do not consider that as part of our calculations for herd immunity.
Thank you
Thank you
very
very
much. Thank you very much for your questions. Premier, there are no more questions from the media.
Thank you very much. I sincerely hope that members of the public found today's press conference informative. Certainly, as we've said, the objective of the 7 days is for us to allow our healthcare system to catch up, make sure that we can stay inside of our homes and not mix households to make sure we slow down the chains of transmission. I want to remind persons that you can go to gov.bm for all of the information of which you need and or require. At the top of gov.bm, there are links to the curfew exemption form in case you need to move during the stay-at-home order. And there's also the links for you to go ahead and get registered for the vaccine or to get tested for the coronavirus. So I want to thank everyone for their attention. We will be with you again later this week. We are not certain of the date, but there is going to be one more where we're going to give advance notice on what we are looking at for what will happen after the expiration of the 7-day stay-at-home order next week, Tuesday. So I want to thank everyone for their attention, and I want everyone to take care. So thank you, Bermuda, and good